Hello everyone, my name is Kinsey Purdue, and today I'm going to be giving a short presentation about the importance of sleep and giving you a few tips on how to get better sleep, as well as how to identify if you have a sleeping disorder. So first and foremost, what is sleep? Sleep used to be defined as the state of global shutdown, meaning reductions in stimulation from the environment. But the term has now evolved to the distinctive patterns of nerve cell communication involving several brain regionals. Your organs still function normally in sleep, but the endocrine system increases in activity. Sleep is physiologically prompted, dynamic, and a readily reversible state of reduced consciousness that is essential to human survival. Sleep is also generated and maintained by three regions of your brain: the brainstem, diencephalon, and cerebrum. There are also different cycles of sleep. The first one is the non-REM sleep, which is also referred to as slow wave sleep. It is considered rest since rapid eye movement does not occur. The REM cycle is known as rapid eye movement, and it indicates that you are in a deep sleep. It is prompted by signals from the pons in the brainstem, and it is the most important phase. So why is sleep important? Sleep is important for many reasons. A few are that it enhances your ability to learn new material, consolidate memories, and improve creativity. A lack of sleep can affect not only your health, but your academic and athletic performance as well. It is essential for college students to get 7 to 9 hours of sleep every night. There are some factors that can affect your ability to sleep. For example, males statistically sleep better than females. Another statistic is Asian Americans tend to have less sleeping problems than any other ethnic group. Some individual behaviors that can influence your sleep are the pre-sleep use of technology, drinking caffeine, smoking, and alcohol consumption. A few environmental factors, like your room being too hot, too cold, or too bright, along with noises, a disturbance in your daily schedule, or even traveling, may affect your sleep as well. Letting outside factors affect your sleep can lead to developing a sleeping disorder. Around 27% of students in universities are found to be at risk for at least one sleeping disorder. A few of the most common are insomnia, snoring, and parasomnia. Insomnia has affected 30 to 35% of Americans and can be characterized by the difficulty of falling or staying asleep. If insomnia lasts longer than a month, you have chronic insomnia. This impacts around 10% of Americans. Insomnia can be caused by stress, which is known as primary insomnia, or by substance abuse or medical disorders, which is known as secondary insomnia. Half of Americans struggle with snoring. Snoring occurs when breathing is obstructed during sleep. If your snoring develops to be chronic or causes you to wake up feeling like you're choking, you may have sleep apnea, which is much more severe than snoring. If you're experiencing unusual events during sleep, like chronically frightening dreams that wake you up, or sleepwalking, you may have parasomnia. There are also a few treatment options for sleeping disorders. The first one are sleep studies. These are conducted while you sleep and are usually done in a sleep lab within a hospital or at a specialized sleeping clinic. A sleep specialist reviews the findings and recommends appropriate treatments. The second one is medications, which are not the best source of treatment and should only be used if they are doctor recommended or for short-term use, because your body could become reliant on them to sleep. The final one is different sleeping therapies. Some techniques may include muscle relaxation, deep breathing, changes to your sleep routine, and psychotherapy to help you identify and cope with the anxieties or other thoughts that disturb your sleep. The last treatment for better sleep is to live a healthier lifestyle. For example, using your bed strictly for sleeping and napping and keeping it as dark as possible. Cutting caffeine from your diet, watching your food intake before bed, and limiting nighttime technology use are all also good strategies in getting good sleep. I hope you all enjoyed this presentation on sleep and were able to think deeper about your own nighttime routine and what may be affecting your sleep, as well as how to adjust it so you can maximize on your sleeping. Thank you.